This disease is a threat to our nation, our families, our team, and everything we hold dear. So many of you have seen this slide before, or you've seen these principles. Matt has certainly talked about these principles. But early on, the COVID-19 task team identified two key principles that we've focused on, and that's driven our decisions. Number one, provide a safe place to work. Number two, provide jobs within our communities. And we've looked at them in that order, by the way. So this is a bit of a new slide, and slide number 3 here. We're in this together. You've heard Matt say that time and time again. And honestly, if we don't work together in all the things we're going to talk about in the next few slides, it's not going to work. And that's why today is so important. So we're going to work our way through these slides. And obviously, you've heard Matt say, be smart, stay safe, and remain confident. I'm sure you've seen a whole flurry of technical guidance that's come out of the COVID-19 task team as we're trying our darndest to help all of us navigate through this in our efforts to battle COVID-19. And at times, we can certainly lose our way and simply become confused. And I can't stress that enough, because personally, and I've been leading a lot of this and doing a lot of research, and I can get myself sideways at times as well. So I can clearly understand where some of you are, which is a bit of why we put this together. So today we're going to focus on the 4 main pillars of our shared battle plan. If you're not well, stay home. Wash hands often, increase your distance, and cover your face. The last one would be the newest one that's joined the other 3. If we're going to practice these at work and at home, we're going to keep our team and our families safe. So pretty directly, because this is coming very soon, you're going to see this one, which supports that first pillar, not well, stay home. Daily home self-checks. And let me repeat that. These are daily. So we have thermometers coming. And as many of you have felt this issue, and Brent and I were just talking about this earlier, shipping is a bit of a challenge, to say the least. But we do have digital thermometers coming that people can use at home to check themselves before they come to work. So you look what's on the screen here. If the answer is yes to any of these following symptoms, simply contact your HR representative, because we don't want you to come to work. You're not well, and we want you to stay home. We want to have that conversation. And that could be any of the fever, the cough, the shortness of breath, which are the symptoms, or it also could be you've been in close contact with someone tested for or confirmed to have COVID-19. And we've had several of those instances in the past where a very well-meaning team member showed up to tell us that they were exposed. We don't want that. We definitely want them to call in and tell us, not come to the facility. So wash your hands often, and this is pillar number 2. This is the best defense against coronavirus. No matter how they've been talking about this, and the CDC is where we get all but all of our guidance from, the best defense against coronavirus is to wash your hands. And of course, some of those key facts include: avoid close contact with people who are sick, avoid touching your eyes, nose, and mouth with unwashed hands, wash your hands often with soap and water for at least 20 seconds, use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available, and stay home if you're sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. And that takes us over to the slide you see in front of you as well. In addition to not just washing your hands, we've also done required disinfection and cleaning of our workspaces. And if anyone's wondering if they're using the right chemical to clean, check the EPA list. Those are chemicals that are effective in killing coronavirus. This is definitely what we're after here. So some of the key areas that we focused on to protect our team include frequent disinfection of all control keypads, levers, buttons, handles, hand tools, cart handles, forklift controls, high touch point surfaces in break rooms, restrooms, hallways, lobbies, things of that nature. We definitely need to encourage this as much as we possibly can. Again, it's a battle. So that takes us to social distance. And social distance is pillar 3. And I don't want anyone to lose this thought here, and that is the virus is thought to spread mainly from person to person. And that's directly from the CDC. So I'll say that again. The virus is thought to spread mainly from person to person. So where should the bulk of our efforts go? By all means, into anything we can do to separate people or prevent that moisture from moving between people. And we'll talk about that coming up. So remember that some key areas that we're focused are to protect our team are staggering breaks and lunches to minimize the number of people together, maintaining 6 feet of separation, canceling non-essential meetings, ensuring that essential meetings that need to be held can be conducted in a large space with sufficient social distancing, mobile clock in and clock out, and it's been our understanding that that's plateaued a little bit. Work areas that separate it whenever possible. And if we can't do that, then we go on to into slide 8, I should say, preventing moisture transfer, which is a continuation of pillar 3, social distancing. So I want you to look on the top of the screen there where it says, my barrier protects you and your barrier protects me. My barrier protects you, your barrier protects me. I've spent a lot of time as a safety professional working on PPE that protects the individual. In this case, the barriers we're talking about is to limit moisture from traveling, and especially traveling when you can't maintain that 6 foot of distance. So, some of the things that have been thought up and have initiated: hat shield, face coverings, which are well on their way, and for the East should be here by Tuesday, and bandanas. And again, going back to that thought of my barrier protects you, your barrier protects me. Those are all acceptable moisture barriers, stopping moisture from person to person. And yes, they can be worn in combination. Absolutely. Due to limited availability, the shields were first distributed to those not able to achieve social distancing on a regular basis. And we actually started that program before the CDC reversed course a bit here and said, hey, now we recommend wearing face coverings. So how do we wear and care for those face coverings? And if you notice, I'm introducing our newest pillar, which is cover your face. Face coverings, wear and care, how to wear, fit snugly but comfortably against the side of the face. It's got to allow for breathing without restriction. That's important. How does one safely remove a used face covering? Be careful not to touch the eyes, nose, and mouth when removing the face covering, and wash hands immediately after removing. I'd also put in the recommendation there too that wash hands before putting it on as well. Should cloth face coverings be washed? Yes. They need to be routinely washed depending on the frequency of use. So if you're wearing it for the day, absolutely wash it. How do I safely wash my covering? A washing machine should suffice, and that comes directly from the CDC. So the last slide brings back around again the four main pillars of our battle plan. Not well, stay home. Wash your hands often for at least 20 seconds or greater. Increase your distance and cover your face. So one of the things I wanted to point out is as complex as our understanding of this disease is, following these four simple pillars at work, and please follow them at home or out in public settings, will help keep us and our families safe. These are proven ways that the CDC has pushed, the World Health Organization has pushed, and they're obviously effective. We're starting to see the effects of that as well. And with that, as Matt says, thank you, be smart, stay safe, and remain confident.